Good evening, everyone, and welcome to the Health and Human Services Board for January 19th, 2022. We thank the folks that are here and taking on the cooler weather that we're experiencing right now. We appreciate that. And to the committee members that are at home Zooming, welcome as well. Thank you for being here. Roll call, please.
Kathy Leaf. Kara Koch. Present. Dave Osnes. Present. Scotty Yard. Greg Telejohn.
Present.
Paulette Anderson. Deb Lindeman. Natasha Ward. Present. Paul McGinnis.
Oh, that better?
Thank you, Mr. Chair. My name is John Strom. I live in the town of Forest, St. Croix County, Wisconsin. There has been much delight in the demise of the Highland Wind Farm project. I started thinking, was there anything else that can be done with them? Then it dawned on me that the land leases, which are 20-year leases, are about half over. What value do they have? Can they be sold? For how much? Who might buy them? Low rent developers? Mass housing developers? What kind of crops might be grown on some of those? This is a very talented and imaginative group. If I have missed anything, I will be here after the meeting. Come and see me. Thank you.
Thank you, John. For folks at home, can you hear us a lot any better right now? Got a conflict yet?
Chair Osnes, they are having trouble hearing. We're working on the audio. Can the members on Zoom hear us now? No.
Can you guys give me a mic check? Can you hear me online? If you're shaking your head, no, you can't hear me. How'd you hear me? He was just shaking his head by chance. Well, Dr. McGinnis keeps shaking his head. I don't know if he hears me or doesn't hear me.
We can hear each other though, right? Okay. We just can't hear them.
Oh, yeah. Right. Yeah, I can hear.
I hate this. It's so I can't stand the quiet. Now we know how they felt in Apollo 13 when they were waiting for the re-entry and they.
Can you hear us?
Can you guys
Yes.
hear?
Apparently they can't hear us.
Are we
Yeah,
good
there
to
we
go?
go.
Yay!
Hey, Dave.
All right. And with that one, we're going to move into our business items at long last with COVID update. Kelly and Ellie.
So you already called the meeting to order, I take it. We missed that. We're all good then.
And we're all here.
And you're all here. That's great. Well, welcome. Starting off 2022 in a place we've never, ever been before. Ellie's going to take you on a little data tour here of what we've seen since January. I'll talk about the isolation and quarantine guidance that changed from CDC. At an inconvenient time at the end of the year last year, DHS has since approved those recommendations and we're using them here in St. Croix County. We'll talk a little bit about our own testing effort that we are doing at the Services Center, and then just a few updates on the vaccines that we are doing at St. Croix County Public Health. So with that, Ellie, floor is yours.
Thanks, Kelly. Okay, I just want to start us off with kind of a reference point of where we are in terms of community transmission, how much disease is circulating, how many new cases are coming into our community. And this is measured primarily, you've seen on our dashboard. It stays at that red level on the front page every time. It just says high. But what does high really mean? We've talked about this before. High is 100 cases in the last 7 days per 100,000 people. So every region here is placed at the same the same number of people, so we can compare. It's all if it was made up of just 100,000 people. United States, we can see there at the top of the table, they have had about 1,500 cases per 100,000 people in the last 7 days. They're starting to drop off. The US did have their highest point, their highest peak so far. They may go up again, but on January 15 at roughly 1,700 cases. Wisconsin is currently the second highest in the US. You can see that the total new cases for Wisconsin is at 2,771, much greater than the 1,500 that the US is at. They're seeing now just under 3,000 cases per 100,000 people in 7 days. For reference, Minnesota there is sitting at 27th in the US with just over 1,000 cases. St. Croix County per 100,000 people, we are seeing 1,657 cases in 7 days. This is a 14% increase from our previous 7 days. We are still going up. Polk County is just behind at just about 1,600 cases. The asterisk there at their 92% increase is because the disease reporting system we all use went through a change. And so if any cases were sitting there and not gone through the process of becoming a case, if they've just been reported by the lab, but the Polk County hadn't actually created a case yet, the system did that automatically for them recently. So some counties who haven't kept on top of that have seen large increases in their case numbers. Here at St. Croix County, we've always brought in all our cases every day. We are working 7 days a week to bring cases in and making sure they're appropriately counted. Pierce County also is on an increase. They're right about at our level. So we are obviously not the worst in Wisconsin as they're sitting at 2,000, but we are worse than the United States have counted as a whole. All right, what does that really mean and what does that look like? You can see that quick table there in red, the positive cases by month, knowing that's only counted until January 18th for the month of January and the year 2022 at the bottom there. We've already seen 3,194 cases of St. Croix County residents so far this month in 18 days. That has surpassed any other month we have experienced, and you can look at the previous 3 months there and their total case numbers sitting just over to 2,700 at the highest. The epi curve we always want to flatten the curve. Unfortunately, our curve has taken an extreme hike upward. So what we see there now is we are at a new high of seeing over 200 cases a day into St. Croix County. We're actually seeing a 7-day average of 205 cases as of yesterday. The slope of that line is incredibly due to Omicron. We've all heard about it in the news, and we here at St. Croix County are feeling its effects quite significantly. Today, just in reference, today we had 270 cases into St. Croix County. So that 7-day average you see there, that graph will continue to climb. We have not started leveling off yet from our Omicron wave. We are, right, unfortunately, in the middle of it. All right, so who has all the cases? Where are these positive cases and who is testing positive right now? The blue you can see is November. The orange bars are December cases, and January are green cases. They are separated by age groups. The lowest bar being the under 5. Then we're kind of going up in groups of by 4. So what I want to point out is that we can see that even though November, we knew we had a huge surge, we had lots of outbreaks and lots of cases. It did start within our school population. And right now, that's one of very few groups in our 5 to 8-year-olds and our 9 to 12-year-olds where the cases are less than they were, less now in January than they were in November. Note we are not through January, so this is the start of the trend. But we can see over 200 cases in multiple age groups. So a dramatic increase in our 13 to 16-year-olds and our 17 to 20-year-olds, kind of across the board, but most dramatically in our 17 to 20-year-olds and our 13 to 16-year-olds. So in our younger age groups, we're seeing the most dramatic climb in cases in comparison. The most dramatic shift in downward cases is those younger age groups, the 5 to 12-year-olds, but also in our 70 plus. So in November, you can see on the far right there, we had 217 cases, and now in January, 134. So a little, almost half the cases there. Unfortunately, we all know a consequence of a COVID-19 infection may be hospitalization and death. In reporting deaths here, so far we have had 123 St. Croix County residents who have died from COVID-19 since the start of this pandemic. What you see before you is a timeline of deaths from 2021 and 2022. What I want to point out is that this curve of deaths exactly mirrors our case numbers. So the more deaths the more case numbers we have, the more deaths that do result. Death is what's called a lagging indicator, means that sometimes it falls after kind of the hike in the positive cases. We are currently in that hike of positive cases with our Omicron wave. So far in January 2022, you can see at the right-hand side of that graph, we've had 5 deaths. So far in January, we had 19 in December following that November wave we saw. And then following our previous wave of 2020, we had 20 deaths in January. So we're seeing that swing that mirrors kind of our epi curve. Yeah, just for your guys' kind of to break down that 123, it was 39 deaths in 2020. Then we've seen 80 deaths in 2021, and unfortunately, those 5 deaths so far in 2022. People wonder always, and we get many questions, just to kind of reiterate the difference between your risk of death and hospitalization due to your vaccination status. What this is data that the state of Wisconsin releases. We've shown here before, but you don't need to count every one of those blue people or orange people, but note that that is kind of the rate of cases per 100,000 people in December of 2021. This is data released. In summary, of the fully vaccinated, those are the blue people who did turn positive. Of 100,000 fully vaccinated people, there were just over 1,500 cases. There were 1,573 cases. Out of those 100,000 fully vaccinated, there were 18 hospitalizations and 3.6 deaths. So then out of 100,000 not fully vaccinated people, where fully vaccinated again is just completing that primary series, those 2 shots of the COVID vaccine. Of the not fully vaccinated, out of 100,000, there were actually 746.4 cases. There were 176 hospitalizations and actually almost 51 deaths. So out of that 100,000. So a comparison of vaccinating 3.6 deaths out of 100,000 versus 50.8 deaths out of 100,000. It really speaks for itself. Just one other piece that people may be interested, the CDC also tracks this, and Wisconsin, all of our vaccination and all of our data out of St. Croix County, out of all the jurisdictions within Wisconsin, they funnel into the CDC data. And just quickly, you can kind of see the incidence, which is the number of cases, the rate of cases. The black line on top, those are the unvaccinated. And this is now with boosters. So fully vaccinated without a booster, they're the spotted blue line down at the bottom. And fully vaccinated with booster is the solid blue line at the bottom. So you can see the dramatic difference in incidence of COVID-19 per 100,000 population. The most dramatic statement of that is the most recent data they do release is October of 2021, where you have 10 times the risk of testing positive and 20 times the risk of dying from COVID if you are unvaccinated compared to a fully vaccinated person with a booster or additional doses. Where does St. Croix County sit at vaccinations? How are our residents protected? Total population, we are currently at 58.7%. Total population being now counted at 91,838. So we are at over half, not quite to 60% yet of the total population. We can see the age distribution now, our 5 to 11-year-olds. We aren't quite at 20% yet of that population having completed the series, being fully vaccinated, getting those 2 shots. So there is still work to be done. There is still vaccinations offered and available. I think that ends my section, and I'll turn it over to Kelly.
Thanks, Ellie. Yeah, so I'm going to talk a little bit about the new changes CDC brought about at the end of December for us. This was done, I think, can you guys hear me? Yeah, for a variety of reasons. And I think we do have information that says Omicron hits more quickly than other previous strains. So hence some of the changes related to isolation and therefore also quarantine. We have this information updated on our website, on St. Croix County website, but isolation really looks like it is moved to from a 10-day period of isolating in your home to 5 days when symptoms resolve and somebody hasn't had a fever for 24 hours without fever reducing medication. One of the key things that we've talked a lot about with this new isolation and quarantine guidance is regardless, a well-fitting mask is really needed to continue protection after, say your symptoms do resolve and your isolation can end at day 5 or day 6 or day 7. Wearing that well-fitting mask for the remainder of the 10-day period is really key to this. And I think we've discussed this over and over with our schools as well as other places in the community and wanted to reinforce this with you tonight. As far as quarantine goes, so quarantine has also changed. Previously, we had 14-day quarantine, 10-day or 7-day with that negative test at day 6 or 7 to 5 days. Just reinforcing that quarantine period can start the day after your last close contact with a positive case. So it's a little bit what the isolation and quarantine changes look like. And again, you can find that on our website for more information. The CDC has a table related to spelling that out, if I'm vaccinated, if I'm not, if I'm boosted, if I'm not. So next slide, there we go. So at the end of the year, we heard from our hospital partners as we still continue to talk with them that they were just in a space, and you guys got to hear President or CEO Massey at the December meeting related to kind of where the hospital was sitting. We really heard that as an outcry to say, we just can't, the hospitals and clinics just can't keep all the balls in the air. We know community testing sites was something that DHS has pushed and talked about. So we did get into the testing business, and I just kind of want to show you. So we did start our official testing at Public Health on December 20th. We had 3 people show up that day. The following day, we had the Wednesday after, we had almost 70. So word got out fast that we were doing this. This slide just really looks at our percent positive. So it wasn't just worried well coming to get tested. I do think this met a definite need over the holiday season, and feeling good that we did jump onto this. Our staff, we asked for volunteers for people to get trained and test, and obviously wearing full PPE. So we continue to do this on Monday and Wednesdays. Probably wondering how long that will last. I anticipate this lasting as long as there is need. So for sure, I know our rooms are scheduled out until March. But who knows, we may extend that as well. And now that we're trained, it'll be easier to transition to ramping up testing or decreasing based on what we're seeing for need. Next slide, Ellie. Wanted to talk a little bit about the types of testing. So just to be clear, the tests that we are doing on Monday and Wednesdays at the services center are PCR tests. They're molecular tests. They're reliable. They show active infection. But I think it's key to note that results do take longer when more parts of your population are testing. Obviously, labs have to surge up and meet that demand. And we've seen labs across the country not being able to turn out results super quickly. So we've talked a little bit about antigen testing, and I I'm pretty sure Dr. McGinnis will maybe want to comment on antigen testing at some point. We met with our schools this morning, superintendents. We have 2 schools in St. Croix County that are part of the school testing program, one here in New Richmond, and then also Somerset. Antigen tests are really hard to come by. There was a DHS memo, so the state sent out a memo that antigen tests could no longer be used because the capacity, the amount of them, the supply is really, really low right now. We don't have a timeline for when more antigen tests may become available through different community programs, but watching that, if that becomes available, we would add that as well to our testing site. Antibody tests, this graphic you've seen before, antibody tests, all they really do is show a past infection, not using them very actively in this response at all. I don't think our hospitals or clinics are doing them much at all. We are also not reporting them to you. Little bit about vaccination. So this is a crazy number to me, and I couldn't even say this crazy number without special appreciation and thanks to our current staff and all of our volunteers who came in. We did over 10,000 vaccines in 2021. I think it's an incredible number. And again, just so thankful that we had all the help we did and partners that put us up and hosted us, like Northland College here in town in New Richmond. The next slide just breaks down a little bit of vaccination by dose, because people want to say, well, how many first, second doses and boosters did you give? This is all of 2021's data by those different doses in the series. So. And I thought I'd just show a little bit about where we are in January. So thus far, really seen a drop in vaccination at now these are all you have to know by St. Croix County Public Health, these last 3 slides. Our clinics and hospitals tell us that they're still busy filling appointments related to booster doses, first and second doses as well. So that is, I think, it for our presentation.
Any comments or questions?
I had a question.
Yeah, go ahead, Kathy.
So thank you so much for doing the testing at the service center. I actually had a tester last week. But my question is, I mean, you send them out to a lab, so you're not doing the test, getting the results. But it took a long time for me to get my PCR test back. And I don't know if it's just sheer volume across the state that's the problem, or if there's anything that can be done to help that WHS is looking at, because by the time you get your results back, it's, 5 to 6 days.
Yeah, I know that is a really unfortunate, and I do think it is the sheer volume of people testing and timing. So interestingly enough, we are paired with a lab out of Madison, Wisconsin. However, like Polk County, they send all their samples across like 12 states. They're paired with a lab in a whole different state. And I really should check on what their turnaround time availability is. My guess, it is still lengthy, more than 3, 4, 5 days. But yes, that is an issue. And I think as we see people lessen test, not quite the demand for the test, we might see quicker return time. But it's kind of been a bottleneck throughout the last 2 years. So.
And Kelly, with the testing, what's your thoughts on the home tests? Is there pros or cons on that, or does it take longer for the results? I know Dr. McGinnis talked a little bit last week to the Council on Aging and Disabilities, but I'm wondering what your thoughts are, or the good doctor's thoughts.
Sure. Well, I think home testing is going to be, the the federal government put out a link yesterday that any family can receive up to 4 tests. I think we have that link on our website. Home testing certainly has, I think, a place in the response. Right now, as far as public health is concerned, it's really hard for us to determine the reliability of those home tests. One, it's the person at home doing the test, which isn't all bad, but definitely more room for error of people who aren't properly trained. There also is no reporting mechanism. So we're gonna have huge gaps in our data. Our counts in our daily averages will be severely underreported once home testing kits get in the hands of people. I think how we have been practicing in St. Croix County, we aren't usually letting people say, hey, I tested positive on a home test. Tell me about my quarantine and isolation status. We really have trained our disease investigators to make sure at least one person in that home has had a lab confirmed test. Because then I feel safer about results of a home test. If we know there is likely somebody in the home who has had a molecular test positive, we probably can assume if the other people living in that home are symptomatic, those tests are likely reliable and they're testing positive as well, especially with Omicron and the infectiousness. But Dr. McGinnis, Ellie, any thoughts you have as well?
I think, Kelly, you bring up a couple good points. So first off, that the home test, frequently called an antigen or a lateral flow test, if they're positive, that's some pretty good information. That's pretty reliable. If they're negative, there's data that suggests that they can miss an infective period by up to 2 days. So you could be infectious for a couple days before that test turns positive. And potentially even very early, if you have some very early symptoms, the test may still be negative and give you a false sense of security. I appreciate some of the diligence on the county in trying not to ask people to quarantine if they don't really have to, but I think that if you have a positive antigen in the house, others have symptoms, it's reasonable to, at this point in time with the amount of virus that's out there, to assume that that's the case for other individuals. I think one of the comments I would have is related to Omicron, and there's been a lot of information that this is less severe, and indeed the rate of hospitalization has been a little lower with Omicron on a per case basis. The problem is the cases are super high. We haven't seen it hit our county yet, but that's one of the big concerns, is that it could come back and cause some very real stress and problems within our healthcare system. Right now we've got a little gap in here. I'm praying and hoping that continues, but there's good reason for folks to be cautious. Wear the masks, they do work. All the noise out there aside, they do work. Vaccination absolutely, as Ellie showed, absolutely clearly works, and the booster makes a big difference too. So those are also really important. So if you are unvaccinated at this point in time, I would predict that you will likely get Omicron in the next, if you haven't had it already, you're going to get it in the next few weeks. If you had a prior infection with Delta, so if you had an infection back in November, October, anytime like that, there's a very good chance you will get an Omicron infection, simply because the Delta infection doesn't provide nearly as much protection. If you have had your first 2 shots but not your booster, there is a chance you could get Omicron in this, but the chance of you landing in the hospital or experiencing a real serious illness is lower. If you've had the vaccine and the booster, that's the safest spot to be. Still, we should all be cautious and take care of others and use those masks, and that's a really, really important step in this whole process. So I just want to reemphasize that, as I have in the past. It comes back to those basics, and they work.
Natasha.
Kelly, so if a family or a person, I guess, does have a positive antigen test at home, do you have recommendations? Should they follow up with a PCR test? Should they just plan to quarantine? Maybe this is on the website. I'm just curious, what would they do if they have a positive home test?
Yeah, so DHS, we did require a PCR confirmatory test on home tests. That is no longer a requirement. It is recommended. It helps us tremendously in public health with recommendations and kind of next steps for those people to have a lab confirmed test. Certainly if somebody tests at home with a positive antigen, getting a PCR positive at our testing site, or I'm sorry, a PCR test at either our testing site or potentially with their healthcare provider is something good to do. I don't know. That's what we're telling people.
Kara.
Yeah, I just want to take a chance to thank the public health staff and volunteers. My husband and I received our booster a few weeks ago at the services center, and we received the information about the vaccine. It was a smooth and just a very efficient process. So I just wanted to say thank you for that.
And Kaylee, one more quick question. If we've got St. Croix County residents that go to a doctor's, say over in Stillwater or Woodbury, and they have tests taken over there, how big a delay is that for the results to come back to you folks?
Yeah, this isn't something, we had a lot of trouble with this. I've spoke on this before, the reporting mechanism from MDH to Wisconsin DHS. They won't directly report locally, they report to our state, and then those results do get dumped into our electronic surveillance system, which is where all the positive results come into us at St. Croix County Public Health. I don't have a good number for you, Dave, on days that may take. I do know that in looking at daily data and daily reports that come in, I just saw a result that was taken from Woodbury. So I do know that it works. Ellie, I don't know if you have better dates for Dave on that.
I would just say it's gotten a lot better as we've identified certain labs that were lagging and kind of what provider was lagging and reaching out and trying to make that connection so we were getting things faster. We've gotten a lot better results coming from Minnesota. There still are a few places where we are finding hiccups, and Minnesota labs are coming in delayed by 5 days, sometimes 10 days. But it isn't nearly the number that we had seen earlier in 2020 or 2021.
Dr. McGinnis.
Yeah, Dave, thank you. If I can respond to Natasha's question from a clinical standpoint, so not the official standpoint, but the clinical standpoint. If you are at home and you have a positive antigen test or one of these home kit tests that is positive, I believe you should consider that that individual does indeed have COVID, and you should follow all the quarantine and isolation guidelines as recommended. I would not, at this point in time, wait for the PCR result to begin that process. I think at that point you would have exposed a lot of folks because it's just taking so long for the PCR to come back. So I would, at that point in time, based on an antigen test, assume that that individual is positive, and then go on from there with isolation and quarantine for the other family members as appropriate.
Anyone else? Well, Kelly, I'd like to piggyback a little bit on what Kara had just mentioned, and it's amazing the number of phone calls that I've gotten on different folks that have gone in for a shot and a booster, and they said, I was so nervous when I walked in the door, but those good folks from public health made us so relaxed, and it was so easy, and they said they are the best of the best, and I can't think of a better thing to add to that than to thank you all again for all your great work. Thank you. And with that, we'll move on to item number 2, our director's report.
Thank you, Mr. Chair. Good evening, everyone. And thank you to our Public Health Department, Dr. McGinnis, Adam Kostanek, and others who have been instrumental in this pandemic response. I had provided you with a update, a quarterly report here from HHS that where I included division updates, a few highlights from each division to give you maybe a more rounded a more rounded idea of what some of the work is being done in HHS. I've broken it down by divisions. I won't go through it all with you, but I was going to highlight a few areas just to emphasize. I also have Char Lopez here, who's our behavioral health administrator, in case there are specific questions. There's a lot of activity in behavioral health and a lot of complex goings on, so she can help to answer any questions you might have that I can't. But I'll start with behavioral health, and I wanted to update you a little bit on the ARPA positions that we were funded for last year. To date, again, Char's been very busy recruiting and hiring for those open positions. We had 7 positions that were approved by the board, and to date we filled 4 of those. That is, we've offered positions to 4 people who have accepted, and they will begin on January 24th as a cohort and go through an orientation process after that Char has outlined for them. We're still recruiting for a 5th case manager position who would work as a co-responder with law enforcement, and we're recruiting for, or trying to partner with, a community agency to fill 2 FTE peer recovery specialist positions. Those peer recovery positions are a little bit difficult to recruit for because well, of the way that Wisconsin is structured in terms of peer recovery support. But we are hopeful that by the end of the month we'll have an answer from a local provider. I was going to mention Narcan Direct. Narcan, or naloxone, is a medication that reverses opioid overdose. Char has obtained a number of kits from the state of Wisconsin. Narcan can be administered relatively simply through a nasal spray, and it's safe to use. And we've acquired a number of kits from the state. We've trained, let me see here, we've trained 31 HHS staff, and 208 doses of Narcan have been distributed to staff for supply to consumers, people who have a loved one maybe with an addiction, or, like I said, consumers who may have an addiction and are concerned about opioid overdose. And we'll continue to order those kits. We've supplied, I believe, Char can correct me, but I believe we've supplied law enforcement with the Sheriff's Department with some additional Narcan kits. We've just going to highlight that we received our mental health supplemental block grant funding, and we've been assured that we'll receive our substance use disorder, substance abuse block grant funding, supplemental block grant funding. I don't think we've received that yet, no, but it's supposed to be coming. One change to organizational structure has to do with our other guest tonight, which is Kristen Newton, our new ADRC administrator. When Kristen accepted the job effective January 10th, she had previously been in the Behavioral Health Division and had previously supervised Adult Protective Services in that division. When she took the new position at the ADRC as the administrator, it seemed to make sense to us to move the APS services under her supervision at the ADRC. So nothing is going to change in terms of how people access Adult Protective Services or contact them. None of the staff have changed. We've just moved that service area under the ADRC instead of the Behavioral Health Division for continuity and because Kristen supervised that team before. Moving on to Children's Services, I wanted to let you know that the board approved an additional position for Children's Services and Child Protective Services, and that position has been filled. Hannah Price is the person that accepted that social worker position, and they're still recruiting from 4 additional vacancies in youth justice. I think interviews are scheduled next week for that. Children's Services is also collaborating with the CASA program, Court-Appointed Special Advocate program that you may be familiar with. Court-Appointed Special Advocates, or CASA advocates, are intended to be a voice for the children in child protective cases, where the courts would appoint an advocate to a family to work with that family and, again, be the voice of the child. They're going to work closely with our Children's Services Division on shared child protection cases. So we've been in meetings with them. We had one this afternoon, actually, with the Executive Director, Dustin Hader from CASA, and we're negotiating, that is between us, we're negotiating how the two entities can work together on child protection cases to complement one another and not to step on each other's toes or confuse the system by adding a CASA advocate to a child protection case or vice versa. So those are going well. We're having a lunch and learn next, coming up in February, I guess, a lunch and learn with CASA where Dustin will come to HHS and do a presentation for HHS staff and help us better understand how this program will work and how we can partner with them. The Comprehensive Community Services, or CCS, are busy in the recertification process this year. They've completed a lot of provider credentialing. As you can imagine, they contract with a lot of different providers. It keeps Faye busy and her team and the CCS staff in ensuring that these providers all have the proper credentialing. And one thing I wanted to highlight about CCS, I want to say this in a way that doesn't imply we're not doing a good job already, but under Rebecca Kerr as the administrator of CCS, Becky's had an intentional focus on billing efficiencies. As you can imagine, in human service work, the billing process and getting notes done and other documents done on time is complex and confusing oftentimes. And Becky's taken the initiative to look at how we can make these billing efficiencies improve so that we're billing for everything that we're allowed to bill for and bringing in revenue for that program. And Becky did a comparison between a pre-pandemic year, 2019, and last year, 2021, and found that, because of these efforts, found that billable hours, total billable hours for 2021 were actually higher than 2019, even though cases were consumer enrollment was slightly lower in 2021. So even though we had slightly fewer people involved in CCS services in 2021, our total billable hours were actually higher than 2019. So her efforts are paying off, and this is something obviously we want to do across the board in HHS to ensure that our billing practices are capturing all of the available revenue that we can, so that we can expand and grow and buy equipment and all of those things that come with efficient billing practices. Be good stewards of the taxpayers. The ADRC, as I mentioned, Kristen Newton began on January 10th, so she's had 9 days to learn the job so far. And she's jumped right in. She's in Brad Beckman's old office, so if you're at the Services Center, that's where Kristen is also located. I don't know, Mr. Chair, if I can put her on the spot for a minute just to introduce herself to the board and say a little bit about herself. I don't think Kristen was expecting this, so it's going to be a nice surprise for her.
I think it's a great surprise for her.
Maybe we could have Kristen, come on down, Kristen. Just have you come up to the mic and say a few words about yourself. I'm sure I'll hear about this later.
Hi, everybody. Kristin Newton. I've worked for St. Croix County since the year 2002, actually, so I've worn a few hats, migrated a couple different times between behavioral health and when we first started youth community support services a number of years back. I don't even remember exactly when. Colleen might remember. 14 years ago. And then back into emergency services within behavioral health. And a couple years back, I started as a supervisor in behavioral health. And so here I am today as the ADRC administrator, and I'm super excited to be here and just honored to be a part of this and start this new role. Any questions?
Bob, if you don't mind, you and I were very fortunate. We had a lot of great candidates that we interviewed, and Kristen has done a great job. She stood out way above everybody else, and we're very grateful that you are here. One thing I've already found out, that she's got a special light up on her shelf in the back, and she said, "I'm always leaving the light on for you. Come on in anytime." And I told her, I said, "Watch out, Bob already knows that she should never have done that." But we've had some good meetings already, and I appreciate your time and welcome aboard.
Thank you. I appreciate it.
Thank you, Kristen, for coming up on the spur of the moment. I told you you wouldn't have to talk, and then I made you. And I also wanted to thank, in reference to the ADRC, I wanted to thank Dr. McGinnis for, Dr. McGinnis made an effort to go to all of the nutrition sites with the ADRC to talk to consumers, participants at those sites about COVID-19, provide his clinical expertise and just answer questions that participants had. And he volunteered to do that. Wasn't something I asked him to do. And I think the feedback that we've received is that that was very helpful for our seniors who attend those nutrition sites. So thank you to him, and a quick thank you to Amy Romhild, who filled in doing some extra duties in this transition between Brad Beckman leaving and Kristen starting. So Amy really stepped up and took on some additional responsibilities during that time. I wanted to thank her for that. Moving on to the Public Health Division, obviously they've been very busy with the pandemic, but Public Health does a lot of other things too, even in spite of this pandemic. And one of which I wanted to mention tonight had to do with Healthier Together. Healthier Together is a partnership between St. Croix and Pierce counties, where a community health needs assessment is conducted through surveys to determine what county residents in both counties see as health priorities. That community health needs assessment is then translated to a community health improvement plan, where prevention and intervention strategies are developed to address those identified health needs. I think it's safe to say that addiction and mental health concerns are still right at the top of the health assessment feedback, and those will be ongoing priorities for both counties. There's a Healthier Together stakeholder meeting that's coming up on February 17th, where we'll further discuss the health priorities and help shape the community health improvement plan. Moving on to economic support, they've been very busy as well, transitioning to soft phones, and Rhonda wanted me to, I think, make a special point of thanking John and IT for their support in making this transition to soft phones. They also, that is the Economic Support Division, also received some ARPA funding through the consortium that we've used towards technology and equipment upgrades. We've got some additional monitors, so there's dual monitors in some of the flex stations at HHS that can benefit not only economic support when they're in the building, but other HHS staff that have, or any county staff that want to use those flex spaces. There's a lot of policy discussion going on right now around when this public health emergency ends and what that will mean for people's benefits. The public health emergency has prevented some people from being disenrolled from benefits during the emergency. And when that ends, there's going to be some changes around that. So Rhonda provided me with a long list of policy discussions that are taking place now, but as of this writing anyway, the anticipated end date for the public health emergency would be about the end of March, in which case some people would be disenrolled from benefits, healthcare benefits, though there's nuances to that, and I don't want to scare people, but it's just a matter of how do we communicate that to the people that will be affected, how do we communicate this effectively to agencies and others that work with these folks. So that's part of the discussion. It's a partnership between the state and economic support professionals on how do we communicate these things, these changes, when they occur, and what to do next if you're one of the people that's affected by it. So more to come on that, but I was just raising it because it is a very obviously time-sensitive kind of issue that we'll be reporting on going forward. The healthcare campus, I was just going to mention primarily, you're probably aware there were two rules recently that the Supreme Court decided on. One was the OSHA emergency temporary standards that would have mandated vaccine and or testing for private employers with more than 100 employees. And the other was the CMS interim final rule, which would affect primarily healthcare, certain healthcare providers, and require vaccine or exemptions or waivers. The OSHA rule was struck down by the Supreme Court, and it wouldn't have affected, likely wouldn't have affected county services anyway. But the other rule was upheld, the CMS interim final rule, which means that our nursing home will be impacted by that, and we'll have to comply with the vaccine requirements by January 27th. That means that all staff that work at the nursing home and contracted healthcare providers will have to have at least their first vaccine by January 27th or have received approval for a waiver due to medical or strongly held religious beliefs. Now, we've known about this, so we've been preparing for it, and in talking with Sandy, all staff are either vaccinated at this point or have been approved for a waiver. So we should be okay in terms of complying with the CMS rule at this point. There's another due date that I don't have written down here for the second dose of vaccine, but roughly a month after this one. And the ARPA bonuses for the nursing home were paid out at the end of December to staff there who have been diligent throughout this pandemic in protecting the safety of residents and staff. And they've done a really remarkable job in limiting infections to literally only about a handful of staff and residents. And that is kind of the highlights that I came up with, but I'm happy to try and answer questions that you might have, or if I have to, I can bring Shar up here to answer questions about behavioral health.
Any questions or comments for Bob? Natasha?
Can I ask about the Narcan direct training? Is there some type of reporting mechanism then if doses are used, and I guess any other intervention plan that happens after a dose has been used?
Can I ask Shar to come up and answer that? Thank you, Natasha.
Shar Lopez, Behavioral Health Administrator. That's a great question. So part of the Narcan Direct program, they require a monthly reporting. So I report each month how many doses we've actually given out to staff. So not necessarily to staff, to clients. There is a I think there's a monthly meeting we have, or it's quarterly. I've only been part of it once, but there was a lot of discussion surrounding the state wanting to know how many people were saved by that. And there was a lot of discussion around the trauma that occurs with, one, having to have that happen, two, what happens if somebody wasn't saved. So the state backed off and said, we just want to know how many are getting, to people who will give to high-risk staff, or high-risk clients. So kind of to piggyback on that, so the training is, we have a standing order they have a standing order to send us the Narcan, and then we have a standing order from our psychiatrist, who is our medical director of our clinic, to give to the HHS staff who work with high-risk either clients or family members or loved ones, or even any staff that work in areas that have high-risk clients. So we're able to do the training, and I'm the certified trainer, so I can go to anyone who falls into that categories.
Thank you.
Any other questions, comments? Deb?
I just have a quick question. I just was wondering, how long does the Narcan last? How long that you give out, how long is that good for?
So
is there a collection of it later or anything like that, or how does that work?
So I can order as many as we need, and it lasts, it has about a shelf life of about 2 years. And so the stuff we have right now is good through 2024. And I'm told that DHS has let us know that you can still use it after expiration. The effectiveness may decrease, but somebody who may have it a little bit longer, it would still be worth using.
Dr. McGinnis?
Yeah, sure. A couple quick questions and then or a comment. I believe it's still consistent that any family member who has somebody in their household who has a opiate addiction or substance abuse, opiate substance abuse problem should have Narcan with them, and anyone who is struggling with those types of things or has in recent past and not yet fully recovered should have one of these kits with them. If that's my correct understanding, who should those individuals contact with your department to get access to that?
That's another great question. So there, like Bob said, we have 31 staff that have actually been trained. If anybody from the public wants Narcan, they can come to the front desk, and I can come and do a training. It's about a 15-minute training that would be provided to whomever is picking it up. And also there's a couple other staff that are there regularly that are able to train and distribute it.
And my comments are related to the fact that Narcan is highly, highly effective, but it doesn't last for a long period of time. It'll be effective if you administer it. It will wear off after about 15 minutes or so. So if you ever administer Narcan, you should be calling 911 immediately. That's quite important, so that there's additional doses that then are brought to your home, and then that individual's provided care is provided, because they will drop back into that overdose situation. Now, the second comment is that even if they're on an opiate type substance or abusing an opiate type substance that is not high risk, so much of that now is laced with fentanyl that it is the potential to have a bad reaction, even though you think you're only taking something that shouldn't ever do this. That's a real huge problem that's cropped up across the country. And even the suppliers sometimes don't know that this stuff is in tablets they're giving someone. So having that Narcan available makes a huge difference. And then to your point about expiration dates, you're right, it may be less effective, but if it expires, it doesn't become dangerous. It just may not work quite as well. It's still worth giving because the alternative is not good.
And I should have explained too, also when we give out they're actually pencil cases that have 2 doses in there, so 2 4-ounce ounce doses, and then as well as the instructions, there's gloves, there's a one-way valve mask. So Narcan Direct, their training indicates utilizing rescue breathing. However, if they call 911 in our area, they're going to be told to do chest compressions. So when we're doing the training, we're very clear, do what 911 tells you. But they'll be given the opportunity, if they need it, they'll have it accessible in those packs.
Anyone else? Well, Bob, we would like to thank you for all your great work. We know we have a great public health group of folks, but there's also that other side of the fence over there with human services, and St. Croix County is very, very blessed with all the talented county employees that we have, and their commitments and their care that they gave each and every one of our county residents, and would greatly ask if you would please pass on our appreciation to those folks as well. Thank you. And with that, we'll move on to item number 3. Faye, you've been very patient sitting over there waiting.
Yeah, lots of information to share tonight with you all. So within the financials, we are to December of 2021. When you start comparing that to December of 2020, keep in mind that this December is not a final number. We will continue to post revenues to December of 21 and expenses to December of 21, for the next several months. So this numbers in this column will continue to change as we continue to receive revenues and pay expenses. When we're looking at our expenses here on page 63A, you're going to see a lot of red numbers, and those are areas where we went over budget. Not necessarily over budget. We spent money that we didn't initially expect to spend. So some of the areas where we spent additional funds were ADRC, our catered food, our operating supplies, and that was just higher expenses than what we had expected. Other areas was additional grant money that we had received. So APS was one where we had COVID money. Bob mentioned economic support. So we had funds that came through grants, so then we were able to spend additional money that we hadn't initially budgeted for. Just jumping down here to public health on page 20, kind of going through some of these highlights. Outreach and education was one where we spent some additional money. Those were flyers and other information that went out to the public related to COVID. And again, we had grant money that covered a lot of the extra spending that we did. Children's services, so I'm on page 27 now. One of the areas that we continue to have a lot of expenses is our out-of-home placements. That was $489,000 over what we had expected to spend. We're hoping with the additional positions that we have and just some of the efforts that Michelle is working on that will continue, focusing on reducing those out-of-home placements. We did have less. Some of the expensive placements that we had early on in 2021 had all ended. So the expenses have reduced later in the year than compared to what the rate they were at the beginning of the year. Let's see. Under our HHS administration, one of the areas that was over budget was the software purchase. This is on page 32. That was the public health software that we purchased, and we did go live with that here in January, so that was a whirlwind of getting that up and running. But that will have ARPA funds that will be reimbursed to us. So I did talk with the finance director. She's kind of waiting till all of our 2021 ARPA expenses are in, and then we'll do one general ledger entry to post that revenue to cover those expenses for this year. And then 2022, we'll develop a process of how we'll move revenues over to cover the expenses that the board had chose for the ARPA dollars. For our healthcare campus, so I'm on page 33. We did get in general relief money, so we have $763,000 that's showing in the other federal payment. $208,000 was supplemental dollars that we were expecting, and the other was grants that we had applied for that will cover lost revenues from previous years, plus COVID-related expenses that we've continued, for items that we're purchasing, from gowns to masks and other things that Sandy has put in place to keep the residents safe. We did pay out, as Bob mentioned, the for payroll, the retention bonus to the staff, so that money has not posted here again, so that's ARPA funds that will be moved over yet. The other thing I want to mention is we do have $744,000 in deferred revenue, so that's some of that general relief money that came in, but we have until the end of 2022 to spend that money. So we're waiting to work with Sandy and administration on the best use of that money and to identify, additional lost revenues that we may use that for. Couple of areas, so our revenue right now for the nursing home, when you look at them on page 38, we're showing quite a loss. We do have some more, the ARPA money that will come that will help reduce that loss. Other things that are happening is medical assistance has moved from a straight flat rate reimbursement to a PDPM, so there will be an MDS that's completed, and the rate will change every single time a full MDS is due. Just looking at January, we identified it'll be about $5,000 a month increase over what we had in December. So this different rate will help to cover more complex cases, higher level needs from some of our MA residents. It's the same reimbursement that they're doing for our Medicare residents right now, this PDPM, where it's based on the Medicare or the MDS that's completed. In Orchard View, we received a 5% increase on all of our family care residents. So that will be, it looked like, I don't have, I calculated it, but I did not write down that number, and I don't want to speak it off the top of my head because I'll get it wrong. But anyways, for our family care clients, we did get a 5% increase in those rates, which will help our Orchard View out as well. And last, we have our Veterans Services Department. Phil does a great job remaining in budget, identifying the needs to, provide the direct relief to our veterans, so they are right on schedule with their expenses. Any questions for me?
Questions or comments? Carol?
Yeah, I have a quick question. Back to the purchase services, out-of-home placements on page 27 of the packet. I know we are talking about the 489 over budget. I was just looking at the fiscal year 2019 and then 2020, the actual finals, and both of those were higher than what the adopted budget was for fiscal year 21. So I'm wondering if anyone has a, can say why, was there expectation that would be lower in 21? That's why it was budgeted lower. And then I'm not sure what that line item looks like for 2022. I don't remember specifically. And so what are we budgeting for 2022? And, I know COVID kind of threw a wrench in everything, but I was just looking at it and seeing that the adopted budget in 21 is lower than what it was the previous 2 years.
So we had added a position in 21. It was a program aide that was to help with some of those home visits and reunification processes that we thought would have a more of an impact than it did in trying to reduce the number of placements. We had changes to children's long-term support, and so we have to remember this children's services expense line is not just out-of-home placements. That's a big portion of it, but it's also our children's long-term support waiver costs. With the third-party administration and some of that, we thought we were going to have less expenses that we paid, but we did end up covering some fairly large home modifications, which we get fully reimbursed for, but they show up in the budget as, oh, we spent more than we anticipated. We're going to have revenues to offset those. But that was part of why we had reduced that budget, was some of the change in how children's long-term support was being implemented. We thought we wouldn't have as many expenses that the county was going to pay, that more people would be billing directly to that third-party administrator. And I can get more details on that. I think children's COP is about the same as it always was. The other thing, so youth justice now, we had that in 2021. We will not have that in 2022. So we reduced that revenue and that expense hand in hand. We did increase purchase services again in 2022. Yeah, so that did go back up.
All right, thanks. I just wanted to, make sure that we have enough there to provide the services that are needed without worrying about that. So I'm just kind of curious from the history. Thank you.
Any other questions?
I would just add, I mean, I understand your question, and we try and anticipate the costs that we're going to incur, but the complexity of children with complex behavioral health needs, the severity of those needs has dramatically, I would say, increased, and this is kind of anecdotal, but statewide and nationally. So statewide, there's a major discussion around what do we do to respond to these kids with complex behavioral health needs when there's no place to place them in Wisconsin, or limited, I should say, resources to place them in Wisconsin, and sometimes no place. So that's part of the issue, is how do we provide a safety net for those kids that are already in need of these kinds of services. More importantly, or I shouldn't say more importantly, additionally, we're trying to look at how do you prevent those cases from occurring in the first place? How do you keep families united? How do you work with families differently so that the kids aren't removed or don't need to be removed from the home? And that's been a real focus of ours for the past year, but going into 2022, it's more likely that we'll be able to implement some of these ideas to hopefully address parental substance use, address working with families as a whole instead of working just with the child or just with the parents independent of each other, and trying to bring together a system of care where we work with community partners like Family Resource Center, where we work with the state on developing ideas for how to provide care for kids at the intensities that are required or needed for those kids currently. But our intention is to try and, through collaborative efforts with behavioral health, children's services, CCS, all of these different divisions of HHS, try and work collaboratively to have more of an upstream intervention strategy where we're addressing these family needs before they become a crisis, before the child needs to be removed. And I know that takes time, and we don't plan, we don't think ahead with these notions that we're going to make a dramatic improvement year to year, but we do want to move forward with the idea that we will have some impact on reducing these costs going forward. Anyway, that's part of our process in estimating these costs, and we're not always right, but Faye described the financial considerations that went into it, but I'm just trying to describe the human considerations and the state level kinds of concerns that we're addressing.
Any other questions? Faye, a quick one for you. Could you explain or give us kind of an update how the county is reimbursed from the state on expenses that we might have, and the time frame, I think, is almost 60 days from the time we send the bill down there until we actually get something, and sometimes longer than that?
Right. So we have two primary ways of submitting expenses to the state. So one is the CARS reporting, and that's through the 15th of each month. So January 15th, we submitted expenses from December, and we will get reimbursed those on February 5th. Spark, which is the DCF reimbursement, is due by the 28th of the month. So by January 28th, we need to submit December expenses. For whatever reason, they're able to turn that around much quicker, and we still get reimbursed from those in February. So, as you said, December expenses that we incur, we'll see that reimbursement in February. We have multiple claim lines and contracts between, public health and ADRC, children's services, and then in addition to that, so GWAR, that's our aging programs, that's a whole different one. That's actually quite a bit longer leg in there. So by February 5th is when expenses from December are due, and we won't receive that until close to March or April. Great Rivers, so that's the economic support. That one's sent in through Eau Claire, and that's again by the 15th of the month, but that's usually 2 months out, so not till March will we receive that reimbursement for December expenses.
That's why we've got you around, keeping us all in a straight and narrow, and the state as well.
And it isn't just me, it's all the people that work with me, because all I can do to keep my mind straight, and they're the ones who do a lot of that work that goes with it.
You're doing a great job, and we really appreciate all the good work that you're doing as well. So
Thank you.
Keep up the good work. With that, we'll talk about item 4 for just a couple of minutes. Bob, you want to talk about it?
Yeah, thank you, Mr. Chair. I've spoken to Supervisor Ard, who is prepared to give a presentation today, but she's unable to be here. I would speak to one aspect of housing, though, that I think we made some progress on. I know it's limited, but some progress on. And that has to do with using some of these ARPA funds to help with rental assistance for people in need of recovery housing. And we had, in 2021, we had $10,000 of ARPA funding available to us to devote towards rental assistance for people with low income or no income who needed recovery housing. We were able to spend $8,400 to help 14 people access recovery housing who otherwise wouldn't have been able to afford it, likely, in 2021. And that continues. That's a contract we have with Onyx, a recovery housing provider, that will continue to work with them over the next 3 years. We have $30,000 budgeted per year through ARPA funding for this purpose, but it really allows an opportunity for people to get into stable, safe housing who have an addiction, and then can also receive these additional ARPA services like case management, peer recovery support once we get those positions operational to help support them in those environments. And I know it's maybe a drop in the bucket in terms of trying to address some housing issues, but these are things that we have some control over. These are things that we can address fairly quickly and have done so. And it's proven effective and helpful for these 14 individuals. In talking with the director for Onyx, she has verbally stated that it's been a helpful and useful resource for her. That's all I have prepared, though, for housing, okay. Mr. Chair.
Any questions, comments? Okay. Move on. Request for future agenda items. Anyone have anything right now? Seeing none, we'll go to announcements and correspondence. Bob, you have anything?
Yes, Mr. Chair, a couple of things. I wanted to let the board know that we've submitted a letter of assurance for the 2022-2025 Civil Rights Compliance Plan. Colleen over here has done a lot of work organizing that information and data from a variety of team members who are participating in this effort. But we submitted that letter in time. It was due on the 15th of January, stating that we would provide then the Civil Rights Compliance Plan by the due date of about the end of March. And we're working on collecting right now data for that, for the larger civil rights plan that we have to submit. It involves a lot of data collection from our various divisions and from child support and other areas. So we're busy doing that, and I think, Mr. Chair, that is all that I have announcements for.
And I will remind board members, over the next couple of months, we're going to open it up again for those that want to stay at home. You'll be able to Zoom in. The one request that I do have to help us out, because we're working with folks in the admin suite as well, is if you wish to Zoom, please get a hold of me a week before the meeting. Okay? And with that one, our next meeting will be February 16th at 5 p.m. Our meeting is adjourned. Thank you, everyone.